Welcome to the 14th Annual BC Healthcare Awards. I'm Michael McMillan, President and CEO of the Health Employers Association of BC. I am speaking to you from Vancouver, the ancestral and traditional territory of the Musqueam, Squamish, and Tsleil-Waututh First Nations. As you watch this awards presentation, I invite you to pause for a moment and acknowledge the territory from where you are viewing. If this was a typical year, I would have offered these welcoming remarks from the stage of a downtown Vancouver hotel ballroom, and you would be gathered for a luncheon to honor our awards recipients. Of course, the past year has been anything but typical. The nominations period for the 2020 awards ended just as the COVID-19 pandemic arrived in BC, and the awards luncheon, originally scheduled for the end of June, was postponed in light of the public health orders and advice. At that time, we thought that the awards event could be rescheduled for the fall. But of course, with ongoing pandemic-related health and safety precautions, that was not to be the case. Out of respect for those who submitted nominations and appreciation for the great work that was recognized, we have decided to present the 2020 BC Healthcare Awards in this video format. Thank you for watching, and congratulations to all of those who are being honored and recognized.
Thank you, Michael, and thanks to all of you watching this video and joining us to celebrate extraordinary healthcare professionals making a difference in our province. My name is Roy Thorpe-Dorward, and I'm HEABC's Communications Director. Before we hear about our 2020 award recipients, I would like to thank our distinguished judges who made time in their busy schedules to review the nominations and put great care and thought into choosing the award recipients. We know that having such accomplished judges makes the awards all the more meaningful for our award recipients, and we are grateful for their contribution. And to our sponsors, thank you for making these awards possible. The BC Healthcare Awards relies on the generous support of our Gold Apple sponsors, and the program would not be possible without them. If you would like to post information about our award recipients or link to this video or the Gold Apple videos you're about to see, please include our Twitter handle. Before we present the first award, HEABC's Board Chair, Betsy Gibbons, would like to say a few words.
Thank you for the introduction, Roy. Now in their 14th year, the BC Healthcare Awards give us an opportunity to celebrate dedicated individuals who excel beyond the scope of their jobs and provide outstanding care to the people of British Columbia. I have been fortunate to be board chair for the past 9 award presentations, and it has been my great pleasure to personally hand out our Gold Apples and Awards of Merit. I will miss the experience of presenting these awards in person. However, I'm very pleased to take part in this online virtual awards presentation. Over the past 13 years, we have honored some truly remarkable individuals, including nurses, social workers, physicians, paramedics, researchers, physiotherapists, technicians, and technologists. We've also recognized outstanding teams working in the areas of mental health, cancer research, palliative care, infection control, medical management, chronic disease management, and residential care. Today, we are honoring projects and individuals working in such diverse areas as infection control, emergency management, patient care, and workplace psychological health and safety. What they all have in common is that they contribute to improved practices and inspire others to strive for better care and outcomes for patients, clients, and residents. I would also like to congratulate the many people and teams who were nominated for an award, and thank those who took the time to submit nominations. Having facilitated on the judging panel for many years, I know that our judges have an extremely difficult time selecting winners from the many deserving nominees. And because the nominations come from colleagues, patients, and family members, it truly is an honor to be nominated. On behalf of HEABC's Board of Directors, thank you for watching this awards video show and joining us in celebrating significant accomplishments in BC's healthcare community.
The nominations period for the 2020 BC Healthcare Awards closed just as the COVID pandemic hit, As a result, the incredible work by so many healthcare professionals throughout the pandemic period is not captured by this year's award nominations. Of the 65 nominations received in 6 categories, the top nomination, as chosen by our judges, receives the Gold Apple Award, and a second project, at the judge's discretion, may be recognized with an Award of Merit for their achievements. The first award to be presented is the Diana Ma Jones Award of Excellence in Person-Centered Care. This award is generously sponsored by Healthcare Benefit Trust. To present this award, I would like to introduce Shay Shojayi, who was one of our judges for this category. Shay is Director of Operations and Strategic Human Resources with the Chartered Professionals in Human Resources of British Columbia and Yukon. Shay is an advocate for equality, inclusivity, and mental health, and is a member of Immigration Employment Council of BC's Employer Advisory Group.
Hello everyone, I'm Shay Shojayi. On behalf of CPHR, BC and Yukon, and the other judges in these categories, it is a true honor to help present these next awards. I would like to begin with a heartfelt thank you to all healthcare professionals for the sacrifices you make daily. Your courage and dedication deserve our deepest gratitude, and you are all true heroes. This award is named in honor of our 2017 provincial healthcare hero, Diana Ma Jones, who was tragically killed just months after receiving her award. Diana Ma Jones was a champion of person-centered care, and it is our hope that this award encourages others to carry on her legacy by improving care for patients, residents, and clients by focusing on the needs of the person rather than the needs of the system. First up is the Award of Merit in this category. Providing opportunities for patients and family members to have meaningful involvement in care decisions is one of the foundations of person-centered care. In support of this principle, the Intensive Care Unit at Royal Inland Hospital in Kamloops established its first Patient and Family Advisory Council. The intent of the council, which is the first at the hospital and one of the first in the Interior Health Region, is to move towards a co-design model where patient partners and ICU staff collaborate on care decisions. For their work to provide patients and families with a meaningful voice when it comes to care decisions, we present an Award of Merit to Royal Inland Hospital's Intensive Care Unit team. Our Gold Apple in this category goes to Island Health's Scholar in Residence program for their work to build research capacity in the area of patient engagement and patient-oriented research. Please watch this short video to learn more on this important work.
Stigma is one of the fundamental challenges faced by people who use drugs when seeking access to care. This can result in people delaying or avoiding seeking care and services for fear of being judged, turned away, or treated badly. When people are not able to access the care that they need due to stigma, it can be deadly. So, how can stigma be reduced so people feel safer and more willing to access care and services when they need it the most? That is what Scholar in Residence Dr. Bernadette Pauly is seeking answers to.
The Island Health Scholar in Residence program was launched in 2015 to build organizational capacity for research, and specifically research that engaged patients in the design of the research as a way of improving and informing better healthcare services. We know that there's something like a 17-year gap between research findings being generated and being put into practice. As the Scholar in Residence program brings that much closer together.
With overdose deaths sweeping the province, the SIR program couldn't have come at a better time.
What makes the information gathered by this program so valuable is that it's knowledge that's been generated by people with lived experience, people who can identify what the barriers are, but also what the facilitators are to improving access to healthcare.
When we engage people with lived and living experience in the research that we do, we're better able to really get at the kinds of evidence that's going to make a difference to people and their care, in terms of whether that care meets their needs, whether it's delivered in a way that is accessible to them.
I was about 8 months into a 2-year stint where I was homeless. I was unemployed at the time, had all kinds of potential, and I didn't know where to direct it. So this led to me getting a job in a recovery house. And then down the line, it led to me moving over to solid outreach. So it had a huge impact, changed my direction, gave me purpose in life. In our community, it's very common knowledge that you don't want to end up having to go to the hospital. People will wait until it's too late to go get healthcare as a result, and problems get worse. I spent my whole life avoiding the healthcare system because I didn't trust the people within the system. This project gave me a voice.
Due to the effectiveness, the program was extended and an additional $2.5 million in funding for further research has been secured through various funders, including Canadian Institutes of Health Research and Health Canada. Reducing stigma and providing timely care means listening to the needs of those with lived experience. The SIR program is awarded the Gold Apple winner of the Diana Maud Jones Award of Excellence in Person-Centered Care Award. Generously sponsored by Healthcare Benefit Trust.
Next, I am honored to present the first ever award for Outstanding Volunteer. This is a new award to recognize and honor an outstanding individual who is volunteering their time and talents in support of BC's public healthcare system. The nominees in this category are role models for dedication, compassion, and community service who have demonstrated a commitment to supporting public or nonprofit healthcare organizations. This award category is generously sponsored by George & Bell Consulting. The Award of Merit in the Outstanding Volunteer category goes to Doug Morris, a leadership volunteer at Victoria General Hospital. Doug is being honored for providing leadership and mentorship to all the volunteers in the Medical Imaging Volunteer Program. Congratulations, Doug. The Gold Apple Award for Outstanding Volunteer is presented to a photographer who has volunteered his skills and fundraising support to the Eden Gardens Care Home in Nanaimo since 2015. Please watch this short video to learn more about this work.
Day for the past 5 years, a very special individual has arrived on the doorsteps of Eden Gardens. Meet Joe Witkowski. Joe, a volunteer with charisma, infectious positive energy, and a desire to make a difference, has truly touched the lives of residents, their families, and staff at the care home. Originally from the U.S., Joe owned a successful videography company with his partner, specializing in film projects on fundraising, community events, celebrities, and presidents, and sometimes even filming from high above ground in a helicopter.
In 2007, our company had a job on Vancouver Island, which I was completely unfamiliar with. And when I got here, it was one of those beautiful autumn weeks. Beautiful blue skies for an entire week, perfect temperature, and I said right away, this is where I want to retire. I didn't discover Eden Gardens discovered me. My wife had come over here and had volunteered my services to be a photographer. Unbeknownst to me, she was concerned I'd be bored in retirement and I needed a hobby. So I came and shot pictures for a calendar that they were going to sell for fundraising, and it kind of cascaded from there into anytime there was an event, Joe, can you come and take pictures? I'll be there.
One of my fondest memories of Joe is taking this photo for a calendar that we used to raise money for our organization, and Joe hopped up on a 15-foot ladder in the middle of the road. You know, he stayed up on the ladder till he got that perfect shot.
Understanding that loved ones are not always able to attend events held at the care home, Joe captures residents on camera and then shares them with their family and friends so they too can still be a part of it.
When we first moved into this building, which is a beautiful building, the hallways were just blank walls. And your heart goes, my God, this feels almost like a prison, not like what we want this to feel like a home. So we had some quilts donated to us by a local quilting society, and I took those and hung them on the wall, which deadened the sound at least, and gave it a little color to the walls. And then I also made some montages of pictures that residents could stop and look at. And, 1956, oh, I remember 1950, I had a truck like that. So it became talking points that they could talk to their caregivers or their spouses about that, and we pasted those up on the walls too.
Eden Gardens is a registered charity that relies heavily on donations to fund its many programs, and Joe was able to make a significant impact on the fundraising initiatives.
I think Joe deserves this award because he makes a big difference to everybody's lives, those who live here and those who work here, and the family members, and he asks for nothing in return.
Joe, for your commitment to using your many talents to make Eden Gardens a better place, you have been named this year's Outstanding Healthcare Volunteer.
Thank you, Shay, and congratulations to the Award of Merit and Gold Apple recipients in these categories. Next up is Top Innovation. This award is generously sponsored by Boyden Canada. To present this award, I would like to introduce Sherman Chan. Sherman is Director of Family and Settlement Services at Mosaic and Co-Chair of Corrections Canada Pacific Region Ethno-Cultural Advisory Committee.
Hello, I am Sherman Chan. I work at Mosaic as a Director of Family and Settlement Services in Vancouver. I am honored to have the opportunity introducing the award recipients. The Top Innovation Award is for a project or best practice that has brought fresh ideas, ingenuity, or superior problem-solving skills to the health field. Projects nominated in this category have resulted in positive and lasting change, making the top innovation a model for others to follow. The Award of Merit in this category goes to a Northern Health Emergency Management Project team that is working to ensure the safety and well-being of patients by preparing staff and leadership with the tools to manage an emergency event that requires the relocation of patients to another facility. The Relocation and Reconceiving Guides project was successfully tested and used during emergency fire incidents in 2018 and 2019. The Gold Apple Award for Top Innovation goes to an island health team that has had great success in reducing surgical site infections following open heart surgery, resulting in improved outcomes for patients and significant cost savings. Join me in watching this short video to learn more about the work of Island Heart Health Team.
For a patient that has just had open heart surgery, a wound infection can lead to complications, emotional trauma, prolonged hospitalization, and even death.
In 2015, we had an infection rate that was 7.7%, above average for Canada. And unfortunately, it was costing our organization upwards of $900,000 a year. Nobody likes to see a wound infection because it impacts patients. It increases their hospital stays, it decreases their satisfaction, it decreases their healing and their quality of life.
Why was the rate so much higher than the national benchmark? A fragmented reporting system may hold some clues.
The system that used to track surgical site infections was a very manual and labor-intensive system. It involved following all of the surgeries through a paper copy and a lot of gathering information through paper reports. It took a lot of work with the infection control practitioner using these paper reports to track all the different surgeries, track all the different classifications, ensure they were all correct, and then gather all the different information. It involved really trying to communicate with all the different hospitals and try to get all the data gathered. And there was quite a delay trying to get all this information together. There was real challenges in trying to communicate with the different hospitals and get all of the data back together so that we could report and communicate out to surgeons.
Island Health realized that improvements were needed to enhance patient care and reduce post-surgical infections following open heart surgery. Working together with patients and a multidisciplinary team of clinicians, cardiac surgeons, clinical nurse educators, heart health quality management, and infection prevention and control practitioners, a working group was formed to create ways to reduce infection rates. The result? Open heart surgery surgical site infection, OHS SSI, Prevention and Reduction Program.
The Heart Health Program became the first adopter of REDCap. It's a custom data management tool that enables us to have one source and eliminates multiple data sources and paper trails, and providing accurate on-time reporting.
REDCap has now become the tool of choice for data collection of infection rates for frontliners in cardiac patient care. OHS SSI yielded great success. Infection rates per 100 open heart surgery procedures have dropped to 2.3%, and organizational costs reduced by up to $500,000 per year.
It does require essentially a community to make this happen. It's all the quality improvement people, it's the people that input the data, it's the people that identify the infections, it's all of the team members who have buy-in, who want to be better, and that is the most important thing, because it means that we're changing, and it takes buy-in to make change. Everybody likes status quo. Change can be scary, and so it's everybody from the operating room to the wards to the people that decided to track the data, to enter the data, to use the REDCap system. It's everybody that's so important in this entire process.
For pioneering a proactive approach to quality improvement to reduce and prevent surgical site infections, Island Health's Open Heart Surgery Surgical Site Infection Program has been awarded the Gold Apple for Top Innovation, generously sponsored by Boyden Canada.
The next award is for Workplace Health Innovation. This award category is generously sponsored by Vupa Grewa. The nominee in this category recipient projects or best practices that makes use of leading practices to improve workplace and worker health and safety. The award of merit for workplace health innovation is presented to an Island Health team that is improving infection control practices at hospitals. The majority of smartphones and wearable technology used in hospital settings do not have enforced cleaning standards to prevent the transfer and spread of bacteria, and there were no real-world studies examining bacteria elimination of such devices. In response, Island Health launched a study focusing on cleaning best practices for smartphones and other devices and developed a full hospital implementation plan in just 6 months. This work has already resulted in improved cleaning and infection control standards. The Gold Apple in this category goes to a Phaser Health team that is working to improve psychological health and safety for healthcare professionals.
was the last time you did absolutely nothing for 5 minutes and just breathed? That was the exercise given to some 600 Fraser Health staff as part of a study conducted over a 30-day period.
In 2019, our Leadership and Organization Development Department decided to launch an org-wide study to test our hypothesis of whether mindfulness training would improve workforce engagement. The mindfulness study for psychological health really came out of Fraser Health's commitment to have a workplace that's psychologically healthy and safe. And also Fraser Health's commitment to the national standard for psychological health and safety in the workplace. The national standard is a set of guidelines to really establish a system that can address as well as assess psychological factors impacting staff and medical staff's well-being at work. And so engagement is one of those critical factors. This study was one of the largest and most rigorously designed mindfulness intervention studies in a workplace context. Over 600 Fraser Health staff and medical staff participated in one of 3 cohorts. And what we were looking at from the research was cohorts around mindfulness training, breath work, and no intervention to see what the impact would be on engagement and well-being. And we saw clear benefits from both the mindfulness cohort as well as the breath work. So the mindfulness cohort had access to digital videos and mindfulness exercises that they could use 5 to 10 minutes per day. The program also allowed them to invite a buddy. It could be a family member, it could be a friend. It didn't have to be someone within Fraser Health. They could also participate in the training, which would allow them to both see what their experience was that day and send messages to each other. And then the idea was for them to take 5 to 10 minutes during their workday to access some of the videos and to practice some of the exercises.
A follow-up survey showed positive results. Participants in both the mindfulness training and breathwork group showed improvements in well-being, engagement, job satisfaction, performance, and less job burnout. Following the study, participants continued to voluntarily take short mindfulness practice breaks over several months. Some participants felt a continual increase in engagement of their work, a clear indication of the lasting impact mindfulness has on employee well-being.
We've had over 3,500 staff and medical staff participate in the digital mindfulness program that we offered as a part of the study. And then we've also seen teams and groups in some of our clinical settings and our non-clinical settings using mindfulness as a way to open meetings, or we're using them for our large organizational meetings. And we're really finding that people are asking for more. What we're looking at now is studying team mindfulness to try to understand, rather than just an individual impact, what's the impact on the team's productivity. So we're really excited about the opportunity of learning kind of what's the same and what's different about an individual practice versus a team practice.
Programs like mindfulness training are one of the ways Fraser Health is creating a workplace where team members are supported in taking care of their personal psychological health and well-being. Given the profound impact of employee and medical staff well-being on the quality of care and patient experience, attending to psychosocial factors is critical to the long-term health and viability of our healthcare system. For pioneering psychological health and safety programming in the workplace, the Gold Apple in Workplace Health Innovation is awarded to Fraser Health's Mindfulness for Psychological Health study. Generously sponsored by Roper Grail LLP.
Our next presenter is no stranger to the BC Healthcare Awards. Paul Gallant is a certified health executive with nearly 40 years of cross-sectorial experience in healthcare, education, research, and leadership. He has presented at countless conferences and education sessions on topics such as leadership, patient engagement, employee health, and diversity. He's also a longtime member of the BC Healthcare Awards judging panel.
Thank you, Roy. I'm honored to present the final 2 awards of the 2020 BC Healthcare Awards. You know, participating and judging these awards is always a highlight of my year, and such an inspiring experience. First, I'm pleased to present the award for Collaborative Solutions. This award is for a project or best practice that shows how a collaborative and integrated team approach can lead to improved results for staff or patients. The Collaborative Solutions Award is generously sponsored by the Doctors of BC. The Award of Merit is presented to a new standard of practice in patient care that is being used across emergency departments at Fraser Health. This new model of care is improving outcomes for patients by shifting away from the traditional top-down approach in decision-making. This new culture shift has resulted in decreased wait times, less overcrowding, and greater patient safety. The Gold Apple Award in this category goes to a program that is giving lung transplant patients hope for better quality of life. Let's watch this short video to learn more about this year's Gold Apple winner.
For patients waiting to get a lung transplant, being put on a ventilator means risking permanent heart and lung damage, or even in the worst-case scenario, death. At Vancouver General Hospital, a game-changing solution is giving lung transplant patients hope for a better quality of life. The solution, ECMO, or extracorporeal membrane oxygenation, a collaborative program developed by 42 health partners from more than 10 organizations.
ECMO is a form of temporary life support, which functions like a heart-lung machine outside the body. So when either the heart or the lungs are failing, it's a form of support that can actually take the blood out of the body, spin it, provide oxygen, and return it to the body, taking over the function of the heart or lungs, often with the hope of recovery for sometimes to bridge to other either devices or potentially transplant. To be honest, I'm just incredibly proud of what has come from this and through collaboration. You know, we see these patients who are on death's doorstep and often have a very low or dismal chance of survival and are walking out of the hospital and leading these amazing, beautiful lives. And it's because everyone has come together and looking towards that patient-centric outcome or goal that something like this has occurred.
The program is the first in Canada to receive the prestigious gold-level status from the Extracorporeal Life Support Organization, an international nonprofit organization established in 1989 to support healthcare professionals and scientists who are involved in extracorporeal membrane oxygenation.
Growing up, I had the chronic condition of cystic fibrosis, which was under control up until 2019 when I became critically ill and was no longer able to fight infection. I was hospitalized at St. Paul's initially and then had to be transferred to Vancouver General Hospital to undergo a very specific type of life support known as ECMO. And without ECMO, I would not be here today, and without ECMO there was no chance of recovery, and that served as a bridge to my lung transplant as my lungs were completely failing.
I think the general consensus among leading individuals in these fields is that it really takes the expertise of an entire team to achieve that gold standard of care for those patients. And 10 years ago, I think patients like Nick probably wouldn't even be alive realistically to get to that point of a transplant, and now we have the opportunity to provide care and bridge them from when they are identified as a transplant candidate to receiving a transplant and being able to then help them with their rehabilitation and get them out of the hospital ultimately.
Vancouver General Hospital's ECMO program brings together the expertise of a multidisciplinary team that enables them to provide this gold standard of care, including doctors, nurses, care aides, occupational therapists, perfusionists, respiratory therapists, physiotherapists, pharmacists, social workers, spiritual care practitioners, ECLS specialists, and dietitians. For reducing mortality and improving the quality of life for patients who require ventilation, the Gold Apple in Collaborative Solutions is awarded to VCH's One System of Care, Partnering to Save Lives in BC program. Generously sponsored by Doctors of BC.
The final award is the Healthcare Hero Award. This award is generously sponsored by Pacific Blue Cross. The Healthcare Hero Award recognizes individuals who go above and beyond in their normal duties and exceed expectations at every turn. Whether they are longtime employees nominated for a lifetime achievement or a fresh face who's made a difference in a short time, a healthcare hero is someone who their colleagues can look to for inspiration. First, the Awards of Merit. And with so many worthy nominations, we have created 2 Awards of Merit in this category. The first is presented to Dr. Richard Merchant. Dr. Merchant is an anesthesiologist at Royal Columbian Hospital, whose achievements as a change agent and best practice innovator are legendary. Dr. Merchant helped set up the Royal Columbian Hospital cardiac surgery program and pioneered the rapid surgical recovery protocol for cardiac surgery. This protocol, which is known as enhanced recovery after surgery, is designed to quickly return patients to their baseline health. This initiative has led to a 50% drop in length of patient stays, a reduced rate of complications, and improved health outcomes, while increasing patient satisfaction. With the many initiatives Dr. Merchant has led since joining Royal Columbian Hospital in 1991, he is indeed a very worthy recipient of a Healthcare Hero Award of Merit. The second Award of Merit goes to Suzanne Leibauer. Suzanne is Executive Director of the Castlegar Hospice Society, where she's played a critical part in the success of the hospice's groundbreaking virtual reality program, attracting international attention. The program uses virtual reality setup that allows hospice patients to virtually visit travel destinations, their homes, and family events, such as weddings, resulting in precious memories and improved quality of life. The Gold Apple Healthcare Hero Award goes to a pediatric nurse at BC Children's Hospital, who throughout her 30-year career has demonstrated unparalleled compassion and an unwavering commitment to those who are most in need, consistently advocating for diversity and inclusion. To learn about our Gold Apple recipient, please watch this short video.
Linda's always been super nice, she's super funny, and she's always super interested in me.
Linda Warner has always been a champion for social advocacy in the community and abroad. Her calling was in nursing, and the moment she started nursing at UBC, Linda says she knew that she had found her place.
My first job was working with babies of mothers that are addicted to narcotics. From there, I went to Japan for a brief opportunity as a school nurse and educator. Since then, I basically returned back to Children's Hospital and worked in a variety of units and have since moved into research, starting with vaccines and in the last 11 years with the child cohort study.
The CHILD study is a cross-Canada study looking at the growth and development of children and their immune systems. Asthma and allergies are a primary focus, but there are lots of other aspects of childhood health that they're beginning to look at as a result of some of the results they've seen.
Linda's the heart and soul of child study, and really probably her greatest contribution has been to engage with the children and their families as true partners in research. She helped develop child studies participant engagement strategy. She then designed and implemented surveys, feedback surveys, where the children and the families told us what was good, what wasn't so good, and what we could do better. And then this ultimately culminated in Linda forming a participant engagement committee that helps us actually shape what the child study does. So this true commitment to having the patients as our partners is Linda's legacy to the child study.
I think she should be a healthcare hero because she really believes that we can make a better future for other children and other families too.
She takes the time and she has the interest and she motivates everybody else to be just as enthusiastic. And Luna was saying this was like the best day of my life, you know, and it was a blood test. And I was like, you know, they took a blood test. And I'm like, yeah, but it was so exciting.
A humanitarian at heart, Linda believes in effective healthcare for everyone, everywhere, and has volunteered with charities in many marginalized communities that have been devastated by destruction and poverty, including the Dominican Republic, Mexico, Haiti, and Tanzania. Her achievements have not gone unnoticed. News outlets such as the Vancouver Sun and the North Shore News have featured articles on Linda's volunteerism and her dedication to community building. One of her crowning achievements is volunteering as a pediatric nurse in Haiti with Rose Charities, a Canadian charity helping people overcome poverty through education, community support, and healthcare.
I think one of the favorite moments I have in my nursing career was not in Canada. It was probably in Haiti. And the reason it was a favorite moment for me was because it gave me gratitude for the healthcare system that we have in Canada. It also helped me realize I can make a difference, but I had a baby that I was looking after that had been dropped on the steps of this hospital in a very poor community. And the children in this ward were nothing like here. They had disease that are curable in Canada, so vaccine preventable or able to be treated through surgery. And I had a baby in my arms that died. And I held her and I was singing to her. I recognized that I could make a difference even in this small child's world until she died by singing to her. I could feel her snuggling into me. But it also gave me gratitude and hope for when I came home that I could be part of a bigger system that would help improve healthcare and also lives of children, which has always been my biggest area that I'm passionate about.
For being a passionate healthcare champion with an unfailing loyalty and commitment to social advocacy for those in need, as well as inspiring others to follow suit. Linda Warner, you are this year's healthcare hero. Generously sponsored by Pacific Blue Cross.
Thank you for watching the 2020 BC Healthcare Awards. Gold Apple videos are posted to our YouTube channel if you want to view them again or share them with colleagues, family, and friends. Follow us on Twitter or check the award website for more information.